This is part one of the recording for Diagnosis Coding Endocrine chapter. And before we get too far into the recording, I would like you to have your handbook open to the first page of the chapter, as well as your diagnosis codebook index to the main term, diabetes. And that should be right around page 97. This endocrine chapter focuses mostly on the disorder diabetes, although there are other endocrine disorders and nutritional metabolic diseases as well. Most of those are straightforward. We'll talk about diabetes, and we will also talk about cystic fibrosis at the end. So in diabetes, there are several different types of diabetes. And actually, if you look at page 161 in your handbook under types of diabetes, it shows 5 different types. The E08 category, or E08 I should say, is a type of secondary diabetes. That is, it's not the normal disease process that one might think, but a patient has diabetes because of another condition, an underlying condition. A patient could also have diabetes due to drugs or chemicals, maybe steroids or other types that the patient has been on long term, and they result in a secondary diabetes. Those fall into category E09. And then there are the two categories. E10 is for type 1 diabetes mellitus, which most often requires insulin on a regular basis. And then the category E11 represents type 2 diabetes, which typically does not require long-term care or long-term insulin. It may require insulin from time to time, but is managed mostly by diet and exercise. And then the final or fifth category of diabetes, E13 category code, is other specified diabetes. And that might be because the patient has had partial or total pancreatectomy. They no longer have their pancreas, and so they have diabetes due to that. That is another type of secondary diabetes. Or it might be due to some other trauma or damage to the diabetes that is not from an underlying condition or is not from medications. And in this chapter, on the first page of the chapter in the handbook, you do have under the section Terms to Know the definitions of diabetes mellitus and the type 1 and type 2, so it would be good for you to be familiar with that. I also might mention that gestational diabetes or diabetes as a result of pregnancy is not covered in this chapter. It is covered in the OB chapter later on in this handbook. That is a diabetes that will go away once the mom has given birth to the baby. Again, not covered in this chapter. So as we look at the 5 types of diabetes that I mentioned, I want to refer you to your index in your code book, and you can look at diabetes and then go to the subterm with, and you can see all sorts of manifestations. Notice that all of those codes start with E11, and that goes along with the coding rule that if your medical record documentation does not indicate what type of diabetes the patient has, the default is type 2, the E11 category. I also might point out by the first main term diabetes, the non-essential modifiers are mellitus and sugar. So you don't need to have those terms documented in your chart, or if you they are documented in your chart, then you can see that they're listed there right away after the first main term. Going further down in the index, once we get past the subterm with, we then have brittle, bronzed, complicating, due to, and it refers you on to the different types of diabetes. Next we have diabetes due to drug or chemical. And again, you would go to this area if your documentation indicated that the patient's diabetes was due to a drug or chemical. You end up in the E09 category. I strongly recommend that you highlight or somehow indicate due to drug and chemical so you get to the right area in the index if you need to. Further down that column, you're going to see due to underlying condition, and here again you end up in the E08 category or E08. Further along in the diabetes index entries, you see gestational, and again we are not covering that here. Go down to diabetes out of control, and it says code to diabetes by type with hyperglycemia. Diabetes poorly controlled refers you to diabetes by type with hyperglycemia, post-pancreatectomy, specified type, and specified type not elsewhere classifiable will get you to category E13. And going further down, steroid induced, see diabetes due to drug or chemical, and then finally we have our type 1, and as we move through that in the index you have the type 2. So again, I strongly recommend that you highlight these 5 areas in your index: diabetes due to underlying condition, drug or chemical induced diabetes, type 1, type 2, and then the other specified, or your index indicates it as specified type not elsewhere classifiable. Now I want to take a look at an example under type 1 diabetes, and let's say your patient record indicates that the patient has diabetes with neuropathy complication, and the patient also has ophthalmic complications due to diabetes. The patient's a type 1. So this particular record or patient has a couple complications, and you should know your handbook indicates to you that you can list as many diabetes codes as you need to list to cover all the conditions that the patient has due to diabetes. So in this patient record, you could code type 1 with the neuropathy, which is E10.21. No, that's nephropathy. Neuropathy is E10.40. And then you would also code E10.39 because the record indicated they also had ophthalmic complications. The requirements for sequencing are or follow: what is the principal diagnosis? Why is that patient being seen? If this patient is coming in to see an ophthalmologist, then the ophthalmology complication code would be listed first, and you would add on the neuropathy afterwards. So depending on the visit, what's going on is what indicates the sequencing order. I want to bring your attention back to the handbook now, and under the types of diabetes, we talked about the 5 categories. I want to move down to some of the text below that and highlight a few things to you. Again, I mentioned briefly earlier, just because a patient is receiving insulin does not make them an automatic type 1. Sometimes type 2 diabetics do take insulin from time to time. So be sure that you assign your type of diabetes appropriately and carefully. Um, if a type 2 diabetic is using insulin on a long-term basis, we would add a code to indicate that, and that is code Z79.4, long-term use of insulin, and you could find that under the main term long-term or long-term use in your index. The text in this area also indicates alternate terminology for type 1 diabetes. May also be described as ketosis prone, juvenile type, juvenile onset, or juvenile diabetes. However, keep in mind the age of the patient does not determine the type of diabetes. These are just synonyms, if you will. Type 2 diabetes, alternate terminology might be ketose resistant, and again, you would use that as a synonym. You should be reading the rest of the area text under this section here. Much of it I've already discussed with you. One thing I might mention is that if you have a diabetic patient with multiple diabetic complications, again, you can use as many of the codes within that category as you need. The sequencing is according to why they're being seen. And just make special note to catch yourself or to watch for if you are coding a patient as type 1 diabetic, all of the codes should be in the E10 category. Or if you're coding them as diabetic due to a drug or chemical, all of their diabetic codes should be from the E09 category. Never on the same patient are you going to mix the E categories. They're either all E08, all E09 on the patient, all E10, and so on. As far as diabetic complications go, you would code according to the category of diabetes, and then the word with would help you pick up what particular complication they have. From the index and the code that you receive, always go back to the tabular, because oftentimes with diabetes there are extra digits. Sometimes the codes are valid with 4, 5, or 6 characters, and sometimes 7 are required, so you'll always want to use the index, or use the tabular, excuse me, and oftentimes there is going to be an instructional note to have you code first or code an additional code if it's appropriate. This ends the discussion on diabetes, and I will do another short recording on the remainder of the chapter.